Good afternoon. Welcome to the daily briefing here at the St. Clair County EMA office, where Sam Bierman from the Health Department will be bringing us the numbers for today, followed up by Chairman Kern and a special guest that we have joining us today. Sam?
Good afternoon. Thank you for having us again. As of today, we have tested 5,703 residents for St. Clair County, 983 of which are positive, which is an increase of 22 from yesterday. And that includes both males and females from their teens up to their 90s. We are at 4,605 negative test results, with 115 results still pending. We do have some sad news to announce today. We will be reporting one additional death, which takes our total to 74. The new death is a female in her 80s who had unknown health conditions. And as always, our condolences go out to that family. For those that have completed the IDPH required 14-day quarantine period, we are at 621. For state totals, we have tested 697,133 with 105,444 positive test results, which is an increase of 2,758 from yesterday. We have 4,715 deaths, which is an increase of 110 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we have 56 patients that are admitted due to COVID-related reasons, and 3 of those are on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 23 cases and 2 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 11 cases and no deaths. Colonnade Senior Living in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville has 104 cases and 20 deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 7 cases and no deaths. Lebanon Care Center in Lebanon has 51 cases and 9 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 7 cases and no deaths. St. Paul's Home in Belleville has 16 cases and 4 deaths. Swansea Rehab and Care Center has 6 cases and no deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Thanks, Sam. 301 people got tested since yesterday.
Yes.
So congratulations to St. Clair County. We appreciate you getting out there and getting tested. That's the one of the ways that we're going to be able to make sure we get through this safely. At this time, we'll go into our zip code reports. We do have a new zip code to report today. Again, this time it's 62059, and there are 7 in that particular zip code. 62201, we remain at 13. 62203, we now have 35. That's an increase of 1. 62204, we now have 40. That's an increase of 3. 62205, we now have 42. That's an increase of 1. 62206, we now have 88 COVID positive people. In 62207, the number goes down today to 62. So we went up 3 yesterday. Today we're going down 3. That happens for various reasons, as we talk about, mainly when people go into a place, the zip code's reported incorrectly at the time, and so when they check out, then they're put in the proper zip code. In 62208, we now have 56. That's an increase of 1. In 62220, we now have 112. That's an increase of 7. 62221, we now have 91. That's an increase of 10. In 62223, we now have 44. That number remains the same. 62226, we now have 114. That's an increase of 1. In 62232, we stay the same at 17. At 62239, we have 11. That number remains the same. 62243 remains static at 7. 62254 remains the same at 26. 62257 remains the same at 7. 62258 remains the same at 14. In 62264, we now have 9. That's an increase of 1. In 62269, we now have 64. That's an increase of 1. And in 62285, the number remains static at 8. Remember, if you didn't hear your zip code, it doesn't mean that there are no COVID positive people in your zip code. It just means that you haven't risen to the level of 6 yet, or above 5 yet. So keep on paying attention and keep on getting tested. That's good news that 300 people got tested since yesterday. Today we're joined by a guest we've seen before. Jay Wilshire is the president of Touche Regional Hospital. And Jay, welcome back to our program.
Well, thank you. Yeah, it's great to be here.
So, Jay, as things start to open up, and I think everyone's prepared to go to phase 3 of the governor's plan on May 29th, can you talk about just why there are gathering limits, why social distancing, why face coverings still are around, even though we see our numbers start to level out and head down?
Right. You know, it's exciting to have things open up. It's been a long haul, and, you know, people are getting haircuts and they're feeling more comfortable. There's more traffic and so forth. But it's very important that we continue doing what we've been doing, because the numbers support it, and that's why we're at this level. You know, your guests should really pay attention to the rules that have been set forth and have been proven statistically significant. For example, gatherings of 10, wearing your mask, compliance with wearing your mask. And it's hard. Nobody likes doing that, and here we're all socially, compliant. But at Touche, we're even beginning to do audits of our employees to make sure that nobody slips. And if we see somebody in the hallway or a visitor, we'll just kind of point to their face or say, "Do you need a mask at the front?" It's very important we do that. We've had great success, and we do not want to fall back on that.
And so there is a danger that we could go backwards in this thing.
There absolutely is a danger. And yesterday I heard a news clip from Alabama. They're having a hotspot. So we are at great risk for hotspots to perk up, which would infect large numbers, and we could be right back where we were.
So I guess that brings us to, there's a new term, at least it's fairly new to me, or is new to me. There are people who are designated as super spreaders, and actually they say 1 in 5 people out there have the ability to be a super spreader. Can you talk about what a super spreader is?
Right. So a super spreader is somebody that will come into a closed environment or an environment and infect a lot of people. There's a CDC study that occurred March 10th where one person that had some symptoms of a cold went to a choir practice, and everybody was infected. In fact, it sickened, 53 of 61. 3 people required hospitalization, and there were 2 deaths. So in a very rapid fashion, their level of the virus was at the peak where several people could be infected. It was a closed environment, and when you sing, there's more droplets. Just as if when you're yelling and supporting your team at a sporting event, or if you're at a gym and you're breathing heavy, or if you're singing, those types of things, they are high risk in a closed environment.
So what makes a super spreader? It's the stage they're at with COVID-19 in their system?
Yes. And also there's literature out there to support that some people have a higher risk of being a super spreader versus others, just as if some people get more sick from COVID than others.
So some people are better at giving off the virus than others?
Some people are better super spreaders, yeah.
Really? Wow.
So, I don't think it's completely defined what that is. I think the best thing for your listeners to do, though, is to practice the precautions. Super spreaders can be asymptomatic, which means without symptoms, like you and I right now, or they can be symptomatic, which means the cold, the flu, the coughing, the wetness. And your listeners should stay away from anybody like that, especially if they're not practicing the social distancing, wearing the masks, the hand washing, and all of those things. That is a very high-risk situation.
But if they're asymptomatic, you won't know they're a super spreader. So how do we protect ourselves from not only super spreaders that you can tell they're sick,
Right.
but how do you protect yourselves from the ones that aren't sick? I mean, if you see somebody sick, you can walk the other way.
Right.
If you don't see those signs, then that's where the masks come in, I assume.
I think so, and also, the 6-foot rule, all of our restaurants and bars that are opening up and the churches and those types of things, there's going to be pews that are empty, there's going to be the space in between. Make sure you're compliant with all of those things. And I think just having a keen awareness. We need to go on. We need to have a new normal, and we just need to be conscious of this. When you go to the grocery stores, there's the wipes, so that you can wipe off your cart and so forth. And then when you get to your car, wipe your hands off, don't touch your face. Just being conscious of those things, I think, is going to make a huge difference. And honestly, that's what has brought us to where we are today, which is, in a much better place than we were a month ago.
So Southern Illinois Healthcare does a lot of testing. Are there still requirements for testing, or is it pretty much if you go in there, you're going to be tested?
There's a phone number to call, and I didn't bring it. Oh, I'm sorry, I did. 618-646-2596, and we will be able to get you an order at that site. So as time has gone on, more and more people have been able to obtain the testing. And just as you're doing here, the more we can test, the more we'll know, the more the curve gets flattened.
So how's your hospital reacting? Are you is everybody kind of worn out? Are they ready if there is a spike?
Right.
You're ready for it to come back, and you can handle it.
Yes, we can. Everybody is continually prepared for a surge, but what's really been good is it's inching towards business as usual. May 11th, through the governor's proclamation, everybody slowly started their elective surgeries again, and that's been really nice. It's been nice to get more patients in the door, and we're doing a soft opening, because for those elective surgeries, patients have to be cleared from COVID, and they have to be self-quarantined for 72 hours. So if you're going to have a GI procedure or something, that's asking a lot. So it's been a soft start, but it's gone very well. We also have participated on calls with other hospital leaders in Southern Illinois, and everybody's grateful to get back to doing healthy things and so forth. But yet, it's a new normal. It's a completely new normal that we're getting used to.
And you assure people that come in for elective surgery, you're not going to be exposed to COVID when you come in. You're taking all the precautions, at least, to make sure that is minimized.
Right, absolutely. We do a lot of screening and so forth. Our cleaning is enhanced, absolutely, right.
Great. And we appreciate you coming in and talking, especially about this super spreader phenomenon, which is a pretty scary premise.
Right.
Herb?
Well, thanks, Jay, for coming in today, and I appreciate that information. One question I have, and I'm sure you've heard it the same as we have it, some of our listeners have actually posted it from time to time, that the state and the county overreacted on our response. When you hear something like that, what do you say to that? I mean, do you feel everything that has been done has met the mark that we need it to be at in order to have where we are?
Right. I don't think we overreacted at all. This is very serious, and very young people are getting sick. It's extremely hard, and it's still very serious in our long-term care facilities and for the vulnerable populations that have health risk. we need to stay the course. We absolutely need to, and it's very interesting again in Alabama. In the places that opened very, very early, let's see how they are, because we're just opening, and other states did it much earlier. So it's all about competencies and results, data-driven results from the social distancing and those practices. We have to stay the course. So kudos to you for talking to everybody for 70 days in a row, as we mentioned before the broadcast, and communicating the importance of this.
Well, thank you. I noticed when you walked in today, you had your mask
I
on.
do,
And so you're
yeah.
practicing what you're preaching, and
It's the law in Illinois.
we appreciate that. Thank you. And
Thank
as Jay said, our 70th day here, and we're monitoring these numbers every day. We had a couple of calls today about how long will these briefings continue, and the chairman and his task force is committed to being here until we feel it's okay. We saw a spike from back at the the Mother's Day weekend. 2 weeks later, we noticed a spike then. So now we're cautious about what the holiday weekend's coming up here today, Memorial Day weekend. So for the next couple of weeks, we want to see what happens with those numbers. So we're going to be here for those of you who enjoy us. I like to say it's Team St. Clair, and you're a part of that team. Everybody here in St. Clair County, those of you who are supporting what we're doing, we appreciate that. You heard the numbers today that Sam gave out. We had another death, which, one is too many. 22 new positives, and we've said all along, the more testing, we expect to have more positives coming up. Had a good number of tests being done yesterday, so please go out and get tested. You heard what Jay said. You can go there. There's other facilities throughout the county. Check our website out. It's on there, and there's no reason why you have trouble finding it. On the EMA side, we got word today we'll be receiving 10 pallets of supplies come next Tuesday. So we're happy about that, because we'll be able to provide more to our first responders, the hospitals, and other healthcare providers. I wanted to give a big shout out to Mila from the Eastside Health District. A couple of days ago, we had some people saying, well, what do you all do around there? Just wait to give these briefings. And we gave a little example yesterday of what goes on here at the EOC. And last night, into the wee hours of today, Mila from the health department, my assistant director, Brian Whitaker, was on the phone trying to find a young lady and 4 children who one is positive, the other ones are exposed, housing. And
a first responder.
First responder, yeah, and she's a first responder. So, she was in a car trying to take care of 4 kids. So going back and forth with our people at the state of Illinois, trying to find that. Late last night, they were able to get that mission accomplished. So they could have went home at 5 o'clock. But that young lady and those 4 children would have been out there. So the next time somebody thinks that people are just sitting around waiting to come to you at 3:30 to tell you numbers that you say you can find elsewhere, that's not true. We stay busy, and we're going to be here. So we'll be back tomorrow, Saturday. We're here 7 days a week at 3:30 for the next briefing. Cindy and Daisy will be back in a few moments to translate this into our Spanish communities. Thank you, and have a good weekend, a safe weekend. Remember, social distancing, because we're going to be watching 2 weeks from now if everybody behaved herself. And remember, Team St. Clair, be a part of that. Thank you.